Dr. Fruta here.
Hey, what's up? I'm Kamyar, and we're going to talk about type 2 diabetes today. We talked about type 1 and type 2 and the difference between the two types of diabetes in the last video, and I'm going to link that over here. Today, we're going to ask Dr. Fruti a little bit of information about what type 2 diabetes really is. So, can you give us the mechanism behind how diabetes works and how it comes about?
Just simple and fast is that patient starts gaining weight, excess amount of weight. The body compensates by releasing excess amount of insulin. More insulin, the easier the patient is going to gain weight. And eventually the body is going to give up and not make insulin. So initially high level of insulin, patient is going to be fat, obese, and then eventually body is going to give up on making insulin, low insulin, and no insulin, patient is going to be skinny and sick and weak.
Oh, wow, nice. Thank you. Can you tell us about what the symptoms of diabetes are?
Again, symptoms are three main things: excess amount of appetite, and by saying excess, you don't get enough of food, and you just want to eat.
Even when you're full, you're still consuming.
You never get full. You just want to eat.
Yeah.
Excess amount of thirst.
Okay.
You drink gallons and gallons of water. And excess amount of urination. And then when I say excess means something that is unusual. It is not normal for someone to wake up every hour at night and go to the bathroom. So these are
actually symptoms. Now that we're talking about that, let me explain to the people. I actually thought I had diabetes a few weeks ago, and what was happening was I ate. Even though I ate, I would get a little bit, after like about 30-40 minutes of shit. Yeah, what again? What up?
Hello everyone, it's Dr. Fruti here.
Hey, what's up everyone? It's Kamyar. And we're gonna discuss type 2 diabetes. Yes, and we're gonna talk about we're gonna dive more into type 2 diabetes today, because last video we talked about type 1 and type 2, the differences between the two types. And I'm going to link that right there in the video. But today we're going to talk more specifically about type 2 diabetes. So Goldwyn John, can you please tell us how diabetes works, how it comes about?
So it's just in easy words, patient have extra amount of weight. Excess amount of weight brings extra amount of insulin in your body. And more insulin in your body, it's easier for your body to store fat and gain weight. So the body is going to make insulin, because it wants to regulate the level of sugar in our body, and then eventually it's going to give up and not make insulin. So again, just to review, initial phase of type 2 diabetes, patient has high level of insulin. High level of insulin means high weight. Patient is big. Eventually their pancreas is going to burn out, insulin goes down, weight goes down, and patient is going to look skinny and sick. Not a good skinny, but sick.
So can you tell us what are some symptoms that a person with diabetes should expect?
There are various kind of symptoms, and every individual is going to be different, but three main symptoms that is common among population is, one is excess amount of appetite. And when I say excess, in other words, I mean abnormal appetite. You don't get full. You eat, you're still hungry. You eat, you're still hungry. Second symptom is going to be excess amount of thirst. The patient keeps drinking gallons and gallons of water, and that can lead the patient to have excess amount of urination. And excess urination means it's not normal for you to wake up every hour or half an hour at night to go to the bathroom. So these are the three most common symptoms that individuals can experience.
Okay, very good. Actually, that's what you just said reminded me of a couple weeks ago. So what was happening was I was eating, and after a little bit of not eating, like a fasting period of maybe like a few hours, I would get super agitated, and I would tremble, and I was having tremors, and it was hectic, and I thought, what if it's diabetes? And one of the other things that was happening to me was I was going to the bathroom 3 to 4 times a couple nights in that week, I remember. And I got worried. Goldblum was like, let's go, do some glucose tests. So we went and we did a hemoglobin A1C on me, and we found out that thankfully I don't have diabetes. Goldblum, can you explain that test does or how they test for diabetes?
So usually doctors these days, they don't check your blood sugar level because at this hour, at this time when you go to the doctor, and usually people go fasting to the doctor office, your blood sugar can be normal. But that doesn't mean that your blood sugar was normal yesterday or a month before. So that's why, thankfully, researcher invented a new test, which is called hemoglobin A1C, which is a glycosylated hemoglobin in our body, which the level of that hemoglobin is going to show how well our blood sugar was in the trend of 3 months.
Basically, what happens there, I think, is if I say it a little bit easier, it would be sugar is going to get stuck on your red blood cells, and that's what they measure.
Yeah, and it doesn't measure it just for today, but it measured it for the last 90 days.
If I'm not mistaken, it's above 6.5 that it's abnormal. Is it 6.5%? 6%.
6%.
Okay, so above 6%, you're having a problem. You need, usually within a little bit of there's a period between 6 and something that you can.
So if yours is like 6 to 8, the doctor might give you some time, like say, okay, go home, do exercise and a strict diet for a month or two, and come back, we will recheck it again. It doesn't mean for you to have an abnormal hemoglobin A1C today, and your doctor is going to ask you to come back next week to recheck it again, because it's not going to change much.
And they're not going to give you medication for diabetes.
Right away.
Yeah, exactly.
If you have a range of like 6 to 8, but God forbid, if the doctor checks and your hemoglobin A1C is 10, then they're kind of obligated to start with the medication.
Yeah, then it's...
Because that's dangerous.
That's dangerous, exactly.
And type 2 diabetes is not like type 1 diabetes that you're going to start with insulin right away. A lot of type 2 diabetes is on your hand, is on the patient's hand, and they can get themselves better if they want to with diet and exercise. There are medication that can help them, and one of the big medication that these days, and I'm sure a lot of you have heard about it, is metformin. Metformin is actually helps to reduce appetite, helps with the reduction of weight. It does not reduce the blood sugar. So it's a very good medication, and it's the #1 medication that all the doctors start a type 2 diabetic patient on.
It's so funny. Sorry, I didn't mean to smile and laugh, but our dog is waiting by the door, basically glued to the door, meaning take us out. Anyway, so let's finish this up so we can go ahead and take the dog out.
Yeah,
and
he has
let
to
her
be part
let
of
him
every
take it off.
conversation.
Exactly. Anyway, so tell us, are you going to do a video about exercise, how to exercise, what kinds of exercises?
Yeah, and the diet. There's like certain diets that are really good for diabetes and actually can cure diabetes somehow.
Okay. Is there, can you get cured with medication?
It depends on you. If the doctor starts you on metformin and you start strictly on diet and exercise, eventually you can stop metformin and you can have a normal life.
So you're basically saying that it is reversible.
Yeah, I have patients myself that the guy got scared as soon as we told him that he has diabetes, and he stopped eating pizza, fast food, junk food, and he started exercising 2 hours religiously every day. 3 months later, he came back to our office to check everything, and everything was normal.
Perfect. Okay, so great. That's good news. That's good news. If you or someone you know has diabetes, definitely watch this video, leave a comment, tell us about your experiences and what you've seen or what you've experienced with this disease or with this problem.
Or if you have any question regarding treatments or your doctor has started you on a medication and you have a question on it, let us know and we can clear that for you.
Yeah, leave us a comment.
Yeah.
Thanks.
Thank you.
Bye.
Bye.
Cool.